mynews.studio.
A single injection every 2 months could significantly change how we prevent HIV. But as always, there are some barriers to making that a reality.
Today is August 5th, 2025. The World Health Organization has just recommended, for the first time, a long-acting injectable to prevent HIV. Why is this such a significant moment?
For years, HIV prevention meant taking daily pills, what most people know as PrEP. Now, with cabotegravir, those at higher risk can get an injection every 2 months. There's also lenacapavir, which is just twice a year. That's a big deal for anyone who finds a daily pill hard to manage. But it goes beyond just being convenient.
You're talking about adherence, right? The problem of people missing doses, especially where healthcare isn't easy to access?
Exactly. Taking a pill every day can be tough over the long term, especially in lower income settings or for marginalized communities. That's where these long-acting shots help. They take away that daily task and can even reduce the stigma that comes with taking daily medication.
So it's a big step forward for public health. But the next issue is access, right? Are these shots available everywhere yet?
That's the sticking point. Both cabotegravir and lenacapavir are approved in several countries, but getting them widely available and affordable takes time. Patent laws mean generic versions probably won't be on the market until at least 2027.
Is there any way to speed up the process?
VIV Healthcare, which makes cabotegravir, has granted a voluntary license to the medicine's patent pool. That means some generic manufacturers can start preparing for production now. Still, until those patents expire, we're dependent on the original manufacturers and a limited supply.
And what about people in remote or underserved areas, places where clinics and doctors are already stretched thin?
WHO and its partners are focusing there too. They've put together training kits for healthcare workers, covering safe injection, counseling, and follow-up. There's also a push for rapid HIV tests that can be used in pharmacies, clinics, or even by telehealth. That means you don't need a big lab, making it much more feasible for community-level delivery.
Who's footing the bill for these efforts? Are international donors playing a part?
They are. The Global Fund and PEPFAR are investing in training and improving supply chains. Their support is vital for reaching remote areas and keeping costs manageable.
You mentioned marginalized groups earlier. How do the new guidelines make sure these shots actually reach people most at risk?
WHO's new guidelines for 2025 put special focus on groups like sex workers, men who have sex with men, transgender people, and people who inject drugs. The goal is to integrate injectable PrEP into community services, mobile clinics, and harm reduction programs. There's also a strong emphasis on reducing stigma and ensuring people can access these services confidentially.
So are we finally closing the gap in HIV prevention between richer and poorer regions?
It's a move in the right direction, but challenges remain, like patent timelines, expanding training, and building up distribution. The hope is that by 2027, with generics available and wider rollout, we'll see real progress in places like sub-Saharan Africa, where HIV rates are highest.
So putting it all together, a long-acting shot could transform HIV prevention. But we still need to solve access, cost, and logistics. How soon can we expect to overcome these hurdles?
That's the crucial question. The scientific tools are ready. Now it's about political commitment, funding, and logistics. If all three come together, we could see a sharp drop in new HIV infections within a few years.
And looking beyond HIV, does this shift have implications for how we handle other infectious diseases?
It could be a model. If we can make long-acting prevention work for HIV, the same approach might apply to other diseases in the future. It's a test case for making prevention simpler, more accessible, and less stigmatized.
Let's leave it there for today. One shot, a global challenge, and the possibility for real change.
Thanks for joining us as we explored what could become a turning point in public health.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.